So welcome everyone. Thank you for joining us for today's webinar. My name is Leah Hodgson. I'm a science communication intern with CROSH. And today our guest is Dr. Kathryn Sinden, who is an assistant professor at the School of Kinesiology at Lakehead University in Thunder Bay, Ontario. And she's going to be sharing with us the role of sex and gender in applied ergonomic research. So if you have any burning questions or need clarification on anything, feel free to type it into the discussion panel on the side. And we'll try and get back to you when we can, or we can, there's going to be a period at the end for questions as well. So I'll go ahead and pass it on to you, Kathryn, if you're ready to go.
Great, thank you so much. I just want to make sure everyone can hear me okay. Okay, good. So good afternoon, everyone. And I just want to thank you for joining me today for this webinar hosted by CROSH. And I want to thank CROSH as well for offering this opportunity. I'm looking forward to sharing some of the results of my research, my applied ergonomic research, where stratifying analysis of our data, I think, has provided some really important insights, suggesting that considering sex and gender stratified analysis in ergonomic research, I think it has some important implications for developing injury prevention strategies. So I'm going to present some work that I've done with firefighters, which is sort of the base of a lot of the work I've done, but I'm also going to present some new work that we've just done with some police up here in Thunder Bay, as well as some work from my postdoctoral research at Queen's University with paramedics. So just want to make sure this is working. So just before we get started, I thought I would start with a brief review or introduction to ergonomics, although I'm sure everyone on the call has an excellent working definition and concept of ergonomics. But I usually like to start my talks with just sort of talking and providing a baseline for where I'm coming from when I say the word ergonomics. And when we think about the linguistic sort of origins of the word ergonomics, I'm not sure how many of us know or knew or know now that ergonomics is actually derived from two Greek words. So the first word being ergon, which means in English work, and nomos, which in English means natural law. So when we put those things together, when we talk about ergonomics as a discipline for research and or for practice, ergonomics can be defined as the scientific discipline involving the application of natural laws governing human work. So we often think about ergonomics in terms of the physicality of work, but perhaps not as much in terms of the social environment that work and work tasks are performed in, which I think introduces the conceptualization and the thought of how can we consider gender as an important factor when we're thinking about ergonomics and the way that people perform their work tasks. So I like this little picture over on the right here that shows this gentleman looking at a very ill-placed doorknob. And I think it reflects this concept of ergonomics really nicely. And the quote is, you know, it'd be kind of dumb to put that doorknob up there. And what it suggests is that this man, who's probably not tall enough to reach this particular doorknob, is going to need some type of assistive device in order to perform this task of opening the door and entering the room. And as soon as we start introducing these sort of assistive devices, whether it be a ladder or somebody helping him, reach towards this doorknob, we're starting to introduce a risk factor of potential injury. So ergonomics is really about this, understanding the work environment, how work is performed, and with a view on injury risk and reducing injury risk to allow people to return to work, to return home at the end of the day of a full day of work safely. And I think when we're speaking about the origins of the term ergonomics, we must also just take a moment to speak about one of the early founders of ergonomics, Dr. Bernardino Ramazzini, who was an Italian medical professor. So Dr. Ramazzini was around in the early 1600s to the mid 1600s to the early 1700s. And he's actually known as the founder of industrial medicine. So if we think about that, that's almost 400 years ago that someone was out there actually starting to talk about how does our work, so the things that we do every day, how does that influence who we are as people, and how does that influence our health? So he actually studied occupational diseases, and way back 400 years ago, he started advocating for these protective measures for workers. And he actually encouraged the eventual passage of factory safety and workmen's compensation laws. And in the 1700s, he actually wrote a book about occupational diseases and industrial hygiene, which is remarkable. A lot of the themes and comments that he made in his book are remarkably consistent with our present knowledge. And one of the quotes I've pulled is this quote here. And again, this is from Bernardino Ramazzini, and he says, those who work standing, so carpenters, sawyers, carvers, blacksmiths, masons, are liable to varicose veins because the strain on the muscles is such that the circulation of the blood is retarded. Standing even for a short time proves exhausting compared with walking and running, though it be for a long time. Nature delights and is restored by alternating and varied actions. So what strikes me about this particular quote, again, almost 400 years ago, is that we are still talking about the importance of changing body position. So currently we're looking at the effects of standing desks on whether or not that improves circulation in the lower limb. How does that influence productivity? How does that mitigate injuries related to the low back? So it's fascinating and perhaps a little frightening that 400 years later, we're still talking about some of the same issues that he identified about 400 years ago. So then it took another 250 years for British researchers to actually meet and come up with a name that they thought characterized the type of work that we all do and we see so commonly in both the literature and in sort of marketing nowadays with different products. And that word is ergonomics. And ergonomics was actually formally accepted as the name of the new society, and that wasn't until the early 1970s. So quick history lesson on ergonomics that I like to sort of frame my talks in, and sort of getting a little bit more specific about why we think about ergonomics, where there's a lot of known benefits, right, to implementing ergonomics in the field. So it's this practice of sort of both considering the positive and the negative impacts of our interventions on the workplace and on worker health. So you can see from this slide here that ergonomics actually improves the quality and quantity of production output. It improves workplace safety, it can improve productivity, morale within the staff, profit money, and it actually can develop knowledge and technology as well. So ergonomics increases all of these things while decreasing this sort of area over here on the right. So with ergonomic interventions, we can decrease injury risk, we can decrease the number of mistakes or errors people make, fatigue and overexertion, which is definitely a focus of my work right now, decreased absenteeism that often results from these things like higher injury risk. It decreases insurance premiums and workers' compensation claims, medical costs, and retraining. And so when we take that step from actually practicing ergonomics and knowing that this is the known impact of our interventions, and we think about how do we integrate ergonomics into research, these are some of the key dependent variables that we tend to measure, right? We look at how can we actually quantify injury risk from our interventions? Can we quantify fatigue? How do we quantify fatigue and overexertion? And how does that interact with injury risk? And then how can we develop interventions that sort of mitigate some of these things? So it just provides a little bit of a framework for applied ergonomic research. So I like this particular slide here. This is some of the work that we did, that I did in my postdoctoral work at Queen's University. And so when we think, like I've sort of touched on this a little bit, so how does this practice of ergonomics fit within sort of the applied ergonomic research, and what is applied ergonomic research anyways? And I see applied ergonomic research as being the sort of interaction with the workplace and with the researchers. And it's the goal of this work is to be very participative, to be very integrated with the workplace, and to develop at the end of the day objective evidence-based solutions to affect some of the key measurables that I identified on the previous slide that are associated with ergonomic interventions, such as decreasing injury risk, decreasing fatigue, and again, sort of with positive impacts on worker health. So I'm going to come back to this slide a little bit later, but I like to sort of include it because I think it certainly got me thinking. When I see this picture and I started doing this work, I started thinking a little bit more about how should I consider sex differences in sort of developing some of my interventions. So you can see female paramedics, these are both active duty paramedics that played a really important role in developing a tool called the OPAT, which is used to screen paramedics for ability for return to work. And this is one of the tasks that we ended up including in the test. And you can see very distinctly the different sort of lifting strategy employed by both this male paramedic and this female paramedic. So the question is why? So why are they adopting this particular strategy? Is one better than the other? And we'll talk a little bit about that later. And I like this slide. This slide is from some of my firefighter research that I did as part of my PhD work at McMaster University with Dr. Joy McDermott, and as part of our research collaborative that we've called Firewell, which is a research collaboration with firefighters throughout Canada. And this was some of that foundational work that we did. And you can see here, there's four different firefighters performing the exact same lifting task. The two firefighters at the top are actually male firefighters, and the two on the bottom are female firefighters. So you probably can't see a very good depiction of what's happening at the spine in these particular lifting protocols, but you can probably get a fairly good idea that the strategy employed by these male firefighters is slightly different than the lifting strategy employed by female firefighters. And we started later on thinking, are there differences between men and women? Why? And does that have important implications for the type of sort of KT tools that we develop out of this research and injury prevention strategies? So I'm going to delve a little bit more into the firefighting research that we've done. So why firefighting as an applied ergonomic research context? Well, firefighting provides a unique context to study determinants of occupational health while considering the impacts of sex and gender. It's really not surprising to anybody in the webinar that firefighting continues to be one of the last very, very male-dominant occupations that exist. So it provides a really interesting social context in which to sort of study this interaction between injury risk, how people perform work, how people perceive the work environment, and how does that influence work health. So it's definitely one of the most unique environments in order to study the interaction of the impacts of sex and gender on worker health. As well, firefighting is a physically demanding occupation, non-cyclical demands. So you're probably aware that firefighters aren't always out there fighting fires. In fact, they do a lot of different kinds of work. They do a lot of community-based work. They often support the other emergency response personnel. So they often will be called on calls with police for motor vehicle accident, victim extrication, working with paramedics to extract people from their homes sometimes. So they do a lot of different sort of work to supplement the work that our other emergency response personnel complete. But even within the sort of idea of firefighting, sometimes they have to go from 0 to 100 really quickly. So how do those sort of changing non-cyclical demands influence their physical capacity and their work health? And we know that firefighters continue to have a high rate of injuries, and musculoskeletal disorders continue to represent a third of all injuries. So some of the work that we've done is looking at posture, where we know that awkward postures and the way that people perform different lifting strategies can be one of the risk factors for musculoskeletal disorders. And there's also a plethora of other conditions that firefighters are exposed to that increase their risk of injury. So overall, for firefighting provides a really interesting sort of occupational context to study this interaction between high work demands and the influences of sex and gender on worker health. So I think within firefighting, I've talked a little bit about, well, quite a bit about it being a male-dominant occupation. And just to give you an idea in terms of numbers, the statistics continue to show that 3% of all firefighters in services are female. And just as a quick aside, in Thunder Bay, we have about just over 200 firefighters, and they now have 2 female firefighters. So it certainly makes looking at sex-gender differences challenging, but I'll speak to that in a little bit as well. In our cohort of firefighters, some of the data that I'm presenting, this is Hamilton data from the Hamilton Professional Firefighters Association and the City of Hamilton firefighters. Their cohort is a little bit more closely aligned with what we see North America-wise, around 2.8%. And an important consideration that sort of informs the work that we're doing is that female firefighters tend to report more injuries than male firefighters. So 33% more injuries than male firefighters. And this is not just musculoskeletal injuries, this is all injury type. So it provides definitely a platform upon which to build some of this work. So one of the very first studies we did to sort of look at how does the work environment, so certainly looking at how people perform tasks is important and interesting, but before we went there, we thought it was really important to sort of understand gender and how does gender being a more social construct, so how does the work environment shape gender, how might that actually influence female firefighter work health? It's a little bit different than looking at sex differences, which are a little bit more biologically based, right? So when we look at CIHR's definition of gender and sex, these are 2 different constructs, although they often overlap and are interrelate. So they're not necessarily can be considered as binary, but certainly looking at the continuum of sex and gender, which is another discussion for another day. But let's come back to this. So when we think about female firefighters and work health, we ran a qualitative study with At that time, our full cohort of female firefighters, which I believe was, we had 4 female fighters or 5 female firefighters in this particular cohort. And we conducted qualitative interviews. And through those qualitative interviews, we identified these 7 themes. And we published this work in the journal Work. And it's probably one of my most anyways, highly cited publications from this work. And we identified these 7 themes, and they all sort of interrelated to this idea that gender shapes task performance. I'm going to quickly go through them, starting over here. So female firefighters have certainly recognized and identified that firefighting is physically demanding. They know that when they go into this work that they're going to be performing physically demanding work. And that was something that they identified, that they knew that they were getting into, and they accepted. And that was actually part of the reason why they wanted to become firefighters. But they, along with that, they identified individually that they had these sort of perceived physiological differences from their male counterparts. So we know that men and women do function differently from a physiological perspective when we think about things like cardiorespiratory response, when we think about muscle strength. So we know these from the scientific literature, and the female firefighters were also sort of acknowledging these known physiological differences with their male counterparts. And it sort of became the foundation for each of these other themes. So they sort of identified that, hey, you know what, I may not be as strong or as fit as guys, but I can use these compensatory strategies to sort of help me perform these same physically demanding tasks that my male counterparts can perform. And we were sort of thinking about that as researchers and thinking, yeah, that's very interesting. So what are these compensatory strategies, and do they increase the risk for injury? So sometimes we know from ergonomic practice that when people adopt these compensatory strategies, they can sometimes be maladaptive and they can actually increase risk of injury. Is that the case for female firefighters? We didn't know, and that became sort of the foundation for other work that we did. They also identified that there were some issues with equipment. So we know that that women just aren't small men. But equipment that they were given initially was just legitimately male firefighter equipment. So here you go, wear this equipment. And they obviously had issues with gloves. They had issues with boots fitting. And so you can imagine performing this physically demanding work underlined with these sort of known physiological differences. And now you're trying to compensate through these sort of challenges with equipment. So sort of these 3 themes sort of all sort of interrelated, although they come back to this recognition of injury risk as well. And that ties into earning respect. So female firefighters identified that they wanted to earn respect in the workplace, that not only among their colleagues, but also from the public. And this sort of fed into this idea of all these other themes where they kind of felt that, hey, you know what? I don't have the physiological strength. I can't perform the same job, but I can't ask for help. Because if I ask for help, that might suggest that I can't do my job. So if I can't do my job, then I'm not going to have the respect of my peers, and how is that going to, in fact, impact my ability to work on this team? So we kind of started seeing how these socially constructive views were influencing the way that female firefighters were performing their task. And then there was this whole idea of some negative attitudes, which they were downplaying quite a bit actually throughout. But there was some suggestion that there were some negative attitudes from male colleagues that impacted social inclusion. So firefighting is a very team-oriented profession. And so often, as it is with police, and we're hearing the same thing from female police officers, that often activities that were selected to be done outside of the workplace weren't things that necessarily female firefighters that wanted to necessarily participate in, and or if they wanted to, they would just have to put some of their discomfort aside. So it was interesting to us to sort of reflect on these themes, how they're interrelated, and sort of this reflection on how gender shaped task performance. And it became very foundational to some of the work that we're doing now. I wanted to present some of our new work that we're just working on this past year. So this is some of the work that my 4th year thesis student was doing. And he came to me and was very interested in this idea of how gender shapes work health, and wanted to do a similar study with female police officers up here in Thunder Bay. So Thunder Bay provides a very unique context in order to understand policing. I'm not going to get into a lot of that now, but they certainly have had some challenges throughout the last couple of years, particularly with public perception. But the purpose of this study was really to identify and understand the gendered nature of work, health and stress as experienced by police officers in Thunder Bay, Ontario. So these are very preliminary findings. In fact, he's just presented some of this work at a couple of local conferences, and we're in the process of actually adding to some of this work as well. But I think overall what he's found is that social support, so coming to social support, and female firefighters didn't necessarily reflect on this as much, but the police officers certainly talked about the role of social support, and they did come back to this theme of respect. So having respect from their peers, having respect from the public, but moreover from their peers, and relationships, and this idea of a team environment were really important to contributing a positive and or negative work environment. So having positive social support, having respect, having good communication and interrelationships was seen as a good thing in helping reduce work stress. And I just wanted to read this one quote because I thought we heard this time and time again among our female police officers, or something similar to this anyways, but this is a quote from some of his work and from the students' work. So the quote says, "Women are seen as peacemakers. We kind of give them the control." So by them, they're talking about the public in a sort of controversial situation. "Even though I wear the uniform, I think that I am a little less non-threatening. My mouth would help me to de-escalate a situation. I think it's basically how you talk to people." So obviously we haven't pursued this with male police officers, so we may find the same thing with male police officers as well. But I thought it was very interesting that female police officers came back to this idea that I'm not as big, I'm not as strong, I can't overpower somebody like my male colleague can, I have to use other tools. And they literally would point to their tool belt or their belt that they wear and say, "None of this helps me, it's my mouth that helps me. My job is to de-escalate." And they sort of leverage the idea of being a woman in those situations where they can sort of de-escalate these escalating situations. So I thought that was interesting and certainly has impact for not only preserving their health, but also sort of how they can sort of constantly tap into this ability to work these situations. So we're going to continue to pursue that a little bit more. So that's sort of some of the qualitative work that we conducted to look at this relationship between gender and work health. So coming back to the firefighter research, we had conducted that female firefighter work study, and I think something that came out of that was really important and interesting to me was this idea of female firefighters acknowledging physiological differences and acknowledging that they may, or at least identifying that they may be adopting these maladaptive strategies. And I wasn't sure that was necessarily the case, that they were maladaptive. They may just be different. It may in fact be more spine sparing than some of the techniques that were being adopted by their male counterparts. So this is one of the very first projects, the big project that came out of the Firewell Research project that was led again by Dr. Joy McDermott at McMaster University and became sort of the foundation for some of my PhD work. And you can see here we recruited 149 firefighters from the Hamilton Professional Firefighters, and we had them sort of perform these 4 segmented areas of outcomes. We had to complete a series of surveys, a pain body diagram, a functional performance screen, a musculoskeletal screen, and the whole idea behind this was to sort of understand what was the general work health of all these firefighters to provide a baseline for developing interventions that could be used to help improve their work health. The work that I'm going to sort of focus on and present on right now is the functional performance screen, because that was the part of the work that I was responsible for. So the functional performance screen, we were interested in collecting a series of data while they performed these 2 tasks. So the functional task that they were performing was a hose drag task. It was a non-charged hose, but it simulated basically their test that they had to do in order to become a firefighter. We also had them do a stair climb task with a high-rise pack. So again, a task that was very similar to their CPAT test that they have to perform. We had them do a grip strength and a floor lift as well. So these were both static strength tests that we had them do. The primary dependent variable that we were interested in was task performance time, and we collected a couple of physiological measures. So we were looking to see how did, from a physiological perspective, how did firefighters respond? So we calculated heart rate, rate and blood pressure both pre and post task. They performed all of these tasks in their, except for the grip strength and floor lift, but the firefighting tasks they performed in their full bunker gear. And so we certainly looked at all of the data sort of compiled, not stratified by gender, but I'm going to present sort of the gender stratified analysis because that became really interesting. And you will see that the primary limitation of this data is that we have very unbalanced groups. So just the nature of this particular work that we did with this particular group, we had a full sample, though, of most of our females were recruited. I think at this time they had 8 female firefighters. So we had a fairly representative sample of female firefighters, and then this sample includes 104 male firefighters. So obviously unbalanced, but when we looked at this anecdotally, what we kind of found very interesting was that the female firefighters, first of all, appear to be performing the hose drag task faster than their male counterparts. But when we looked at physiological response, it seems to be that the female firefighters were able to tolerate the physiological demands better than their male counterparts. So what I mean by that is that when we looked at the percent change in systolic, diastolic, and heart rate pre versus post, there seemed to be less increase on behalf of female firefighters than male firefighters. So, you know, we're not sure based on this whether this is just simply because obviously our sample is younger, they're smaller, our female firefighters, or is it something to do actually with gender? So this is, or with sex and or gender. So this was something that we're going to continue to look at. But it was an interesting preliminary finding anyways that we presented at ACE back in 2013, the Association for Canadian Ergonomics conference. But this led to the question, is there a relationship between our previous study findings that identified how female firefighters actually experience firefighting, so the gender lens, and task performance outcomes? So in order to sort of answer that question, we reflected these earlier themes that we identified related to female firefighters and how they experience their work environment with some of the physiological outputs that we've identified. So the change in systolic blood pressure, the change in diastolic blood pressure, hose drag time, heart rate time, and was there some type of relationship? Could we use the qualitative or the gendered experience of being a firefighter to explain some of the sex-based differences that we saw based on some of our physiological outcomes? And when we did that, and we sort of did this semi-qualitative reflection through this process, we identified 2 important themes. The first being gender-related physiological differences and compensatory strategies as being probably the most explanatory of some of our physiological findings. So when we think about the gender-related physiological differences, the female firefighters acknowledged and identified they had this physiological disadvantage compared to their male counterparts. So perhaps they were focusing a little bit more on training and perhaps to accommodate and to overcome some of these physiological differences. So that's something that we're going to think a little bit more about and pursue in some of our future work. With respect to compensatory strategies, there were certainly physiological disadvantages that allowed them to sort of adopt some of these compensatory strategies, but perhaps the compensatory strategies that they're using allow them to perform the task more quickly. So we're not sure, and that's something that we were further sort of investigating. In order to do that and to look at some of the kinematic outputs associated with this, because that's what we became interested in. We didn't collect any sort of kinematic data in the first phase of our study, and we sort of became interested in knowing what is happening. Are they sort of adapting sort of these maladaptive strategies? So what we decided to do was, as part of my PhD work, I collected some video data of firefighters performing the exact same tasks and sort of analyzing it in software called Dartfish. You can analyze this in Canovia, whatever kind of software you want, but this is how we did that. And before we did that, we wanted to sort of develop our measurement approach. So we submitted our work. This is some reliability, demonstrating that our approach was reliable for measuring lower limbs. And when we submitted it to review, it came back and said, well, where's your gender stratified analysis or your sex-based, are there any sex-based differences? And so we hadn't done that because that really wasn't the purpose of the study or the paper. But we did, in fact, do that analysis, and we submitted it with the paper. And what we actually found when we started looking at this was that it looks like the female, and these are flexion angles. I didn't do a very good job of defining that, these on this table. These are flexion angles. So if we look at, for example, knee, if you're thinking about 90 degrees being full flexion, the female firefighters are getting closer to full knee flexion than their male counterparts. And then furthermore, their trunk angle suggests that they're using less of a stooped posture than their male counterpart. But the interesting finding was this whole idea of relative hip vertical displacement. So we were looking at how much the hip was moving in the Y plane. And what it looks like is that the female's hip was actually moving more in the Y plane than the male counterparts, suggesting that perhaps they were using more of a spine-sparing lifting technique where they were bending their knees more. So that led us to actually looking to see whether or not, from our posture analysis, are there kinematic differences between male and female firefighters. And so this is some of the work that we presented at the Organization for the Study of Sex Differences last summer, more focused on upper extremity posture and maybe some, the postural adaptations that were used by female and male firefighters when they were performing this lifting task with respect to the upper limb. And what we found was, in fact, that female firefighters actually reached forward less than their male counterparts. So why? It may be that this sort of perception that they have that they need to accommodate for the reduced strength that they have, that they need to actually adopt this more conservative and more spine-sparing lifting technique. Again, something that we need to explore a little bit more deeply, but the early evidence suggests that when we stratify our posture analysis by gender, that it looks like there is some differences in the way that male and female firefighters perform their lifting tasks. So I'm going to quickly move through the last few slides. This is some work that came out of my postdoctoral work, again, that I did at Queen's University with Dr. Steve Fisher out of the Occupational Biomechanics and Ergonomics lab. And when we were developing our tool to screen people for return to work, we actually had the paramedics come into the lab and actually simulate some of the tasks that they would be doing as part of the test. So we had them doing three lift tasks. So one was a stretcher raise, one was a stretcher load, and the other was the patient transfer over here. And we collected, sorry, I'll go back for 1 second. You can see that we collected a bunch of kinematic data we used a Qualys system, and we used two Vertex force plates to collect some kinetic data. And of course, we integrated that data, and we were able to calculate peak sagittal L4, L5 moments. And we also calculated something called relative lower body work ratios. I'm not going to go through overall, probably not surprising that if you're using your lower body more, it was associated with lower peak sagittal trunk angles and moments. But what was interesting when we actually stratified, again, this analysis by sex, is that we found that female paramedics were actually more closely clustered when looking at the relationship between peak sagittal L4, L5 moment and lower body work ratio. And what that sort of seemed to select, this was again just visual inspection, that they seemed to be more clustered together, and seems to suggest to us that they were using a more similar lifting strategy. So we actually looked at that data a little bit more thoroughly. And when you look at the ranges between male and female, and in particular during the load and raise tasks, you can actually see, in fact, that the range is lower for the female paramedics versus the male paramedics. Again, this suggests to us that perhaps a more consistent strategy was being adopted during these two tasks by female paramedics versus male paramedics, which is likely a good thing when it comes back to this slide, that females are more consistently using a more spine-sparing lifting technique than our male paramedics. So just going to provide some overall implications, summary thoughts. I think, and I believe, that incorporating a sex-gender lens on my work has elicited important findings in my applied ergonomic research, and it's certainly led to important questions that I think need to still be answered. And I think from a practice perspective, I think that these findings have suggested that we perhaps need to consider a differential approach to training men and women on spine-sparing lifting techniques, and that perhaps thinking about cardiorespiratory fitness training program versus muscle strength training program might be an important thing to consider. Do men need to maybe focus a little bit more on cardiorespiratory, male firefighters in particular, do they need to maybe focus more on cardiorespiratory fitness compared to muscle strength, and vice versa for females? Or perhaps they're both similarly important, but from an injury prevention standpoint, this might be something important to consider in the future. An important consideration is that in our work, because of the limited distribution that we have between between men and women. We've tended to consider sex and gender as a binary. It might be interesting to look at sex and gender more on a continuum, particularly gender. So those are my sort of concluding thoughts. Just going to leave you with this last slide. I didn't present any of her work today, but this is my grad student. We're doing some work up here in Thunder Bay with Thunder Bay Fire Rescue. And I liked this picture because I have this female grad student in sort of this very male-dominant firefighting equipment. So it kind of, for me, sort of had this interplay between sex and gender. So I just wanted to leave on that and just acknowledge all of the funding sources that allow me to do this exciting, fun work. Thank you.
Awesome. Thank you so much, Kathryn. That was super interesting. I don't see any questions over in the discussion panel, so if anybody has any questions, feel free to shoot them at us now, and Kathryn can answer them. I did have a question. So you had mentioned that the women in the first study that you talked about, they were 33%, was it 33% more injuries or 33% more likely to be injured?
No, they reported 33% more injuries. That's not our work, that's somebody else's study. That's just in the literature.
Okay. Do you know if there's any work, like, so the social factors that you had said about influencing that higher rate of injury, is there work that's being done to kind of implement some changes in terms of how the social environment is at work?
That's a really good question. I'm trying to figure out how to answer that question. I think not work that I'm doing. It's not work that I'm currently doing. I think it's an important question, and I think that's an important consideration when we think about the social dynamics of ergonomics. I think that's I absolutely think that could be important. One of the challenges that we have in working in these male-dominant occupations is that they're very hierarchical, right? So when you go ahead and even doing research, you need to sort of get buy-in from the top in order to make it happen at the bottom. And sometimes it just gets told that this is how things are going to go. So even when we're implementing strategies, there needs to be that thought and consideration. I think if we can get ownership and we can show sort of some of the impacts of this work and bring it forward to management, and get some union support, I think that there's a possibility that we can start thinking about what those strategies might look like and creating a sort of more socially inclusive space. So I think that's a really good question, and it's an important consideration, and particularly as we move forward. It just hasn't been something I've thought about or focused on, but I think it's important.
For sure, thanks. We have two questions from Tammy. So the first is, how do you deal with a small sample size when teasing out biomechanics differences?
Yeah, that's a really good question. One of the things that we're going to be probably doing is sort of a case-matched sort of analysis. So if we have, like, for example, a taller man or a shorter man, or like looking at size comparisons. So basically doing a case control design might be one of the ways that we do that. We can also, in the paramedic work, one of the things I didn't talk about is that we actually normalize to body weight to try and remove some of that. So we can certainly do that as well. It's hard with the small sample sizes to do that, without a doubt. It's one of the limitations of the data.
And another question from Tammy. From an ergonomic perspective, do you still see challenges with fit of tools and PPE for female or smaller male firefighters?
Yeah, and it's not just the fit, it's the social perception. So I'll give you an example. So when they're using gloves, when you're wearing gloves, they call them the women's gloves. So the smaller gloves, gloves can't be genderized, but they genderize them. So they call them the female gloves. So men don't want to wear the female gloves, and neither do women want to wear the female gloves. So they've worked forward, and I'll be honest, based on some of the work that we did, they actually went ahead and started changing some of the equipment. I didn't present the work today from the qualitative work that we did with police, but police have similar challenges with equipment. So the gun belt that they wear wasn't designed for women, it was designed for men. So they end up wearing this extremely high load across their hips. And a lot of female police officers have a lot of back issues resulting from this. So one of the female police officers came in with this whole sort of strategy that she's kind of tried to adopt to try to change the loading on her torso. So I think there's some important work that could be done there. They're Kevlar vests. for the longest time didn't accommodate women's chests, like our breasts. And so women were trying to figure out, how do I wear these? They don't fit properly. So now they've slowly started to make some of these changes for police as well. So it's not just fire. I think police also has some challenges as well. But yeah, they're slowly starting to make some changes. It's hard when it's a very sort of male dominant, and a lot of men tend to be at the top end of the hierarchy, and that's starting to change too. So
great. We have another question here from Brenda. So she said, at the beginning of the presentation, you mentioned that females reported more injuries, but it appears that they're doing work in a way that there would be less injuries. So we're wondering what your comments are on that.
Yeah, that's a good question. I think they are performing it. One of the things that we didn't measure was the kinetic load. That we didn't actually measure what was happening sort of a more at the spine level. So yes, they seem to be doing that, but I still don't know how that's sort of attenuated any sort of moment or force that's going through the body. So that might be something that's interesting for us to measure, because these are very heavy loads, very, very small sample. It could be the way they're performing the test, and it could just be that women tend to access healthcare more than men. It could just be a behavioral thing where women tend to go and seek treatment for care more readily than men do. Anyways, we know that from the literature. So it may actually not have anything to do with kinematics. It may just have something to do with the social constructs that we have about seeking healthcare that's different between men and women. Yeah, I think that might be part of it as well.
And a follow-up question to that was if the injuries that they were reporting were back injuries?
Yeah, I'd have to go back to that article and look that up. I don't think so. It was all injury type. It wasn't just musculoskeletal.
Okay. So I don't see any more questions here. So I think we got everyone. That was a really great presentation. Thank you again so much, Kathryn, for that.
Thanks for having me.
For sure, yeah. And I'm gonna just put up here our poster for our next webinar. So feel free to join us on June 20th at 12:15. We're going to be having our own Dr. Sandra Dorman, who will be talking about learnings from the International Mine Rescue Competition in 2016. So we'll be doing that on June 20th again at 12:15. If you have any more questions for Dr. Sinden or for us at Krosh, feel free to contact us by email, on Twitter, Instagram, or check out our website. You can contact us there, and we'll get back to you on that when we can. So thank you everyone again for joining us, and we'll see you next time.
Thanks everyone.